Thank you. I'm called Rosemary. I'm a CHV, and I'm a CHV. Okay, the main work of CHV, we work in the community. We have households. Most of us, I think all of us, we are having 120 households that we can manage. And in these 120 households, we visit them each and every month to get the challenges that they get. We do health talk. We advise them and encourage them to go to the hospitals, to take their children to the hospitals, to give birth to the hospital. These are the ANC mothers. We discourage TBS. And when we go to these households, we check the problems that they have. There are latrines, there are people who are having toilets, and we walk around to see the challenges that they are getting. Maybe their toilets or their latrines are full, or their drainages or stagnant waters. The most work that we do, we don't treat, but we refer. Our cases we refer. We are not allowed to treat. We can only give paracetamol, and actually paracetamol is only for up to 4 hours. And you advise the mother or the person who is sick to go to the hospital. We also have elderly persons that they are supposed to go for monthly checkups. We also check hygiene. The hygiene, how they bath, how they live, and the type of food that they eat. This is nutrition. And now this is MOH. Now to come to family health integrated project. This is now the care and the rest. We are dealing with the maternal nutrition. We deal with things like gender-based violence, the cases that can interfere with the life of the girl child, the cases that can interfere with the mother when the mother is pregnant, the cases that can interfere with the education of the child. So these are the things that we are doing at the ground. And all these things, when one elapses from 27, we bring the reports to the facility. And these reports, we have reports that goes to the MOH, and we have also reports that goes to the integrated. This is the work that we do. Yeah, we advise people what to eat. We don't tell them to go for expensive things. We have nutrition, it depends with what the person is having. We have the vegetable. Actually, we really advise parents, expectant mothers, these are the ANCs. We advise them to take a lot of energy food. We advise the people at the community to take a lot of natural vegetables. We don't advise them to go for things like meat, chicken flesh, no. It is just by the way if they get money. But we really advise them to take the food that they can get, the ones that are available. And we also teach them how to treat water that they drink. And we also teach them how to manage ways of infection of malaria, to clear the bushes, to cover the open waters, the stagnant waters, and also to cover themselves by mosquito nets. Gender-based violence, first of all, let me come to rape or defilement. We also have the incest cases. But we advise them that when the rape case occurs, they are not to bite themselves for 48 hours. They don't bathe, they don't wash the clothes, even combing the hair. They are not allowed before they report the cases to the hospital, then to police. So the police is to follow, and hospital is to check whether the person is infected or not, to be put on the pen. And the gender-based violence are taken care of with these programs. We try to tell them to use condom. Yeah. Because condom, under this condom, you use it once and you throw, and for the next maybe meeting, you have to use another condom. We also have female condoms.
Okay.
And even nowadays, there is what is called lubricants. We have the water-based and we have the gel. Yeah. So all these things, we train them how to use them. And we keep on. We do for each and everything that we do. We talked and we see how they are really catching up with them.